Hey guys, how's it going? My name is Patrick Godinez, and this is the Foundations of Public Health and my presentation for the Healthy People 2020. So what to expect in my presentation is what I'll be going over is the description of physical activity in relation to exercising, Oregon's regulations on physical activity in public-private schools, data showing progression of physical activity in kindergarten through 6th grade, programs for after school, before school, summer school, and etc. Like vacations and whatnot, and data of information, costs of applicants, number of students, the pros, benefits, cons, disadvantages for students, and I'm going to be ending it with but why. Why does this all matter? So for my topic, physical activity and the current status of the objective of physical activity 10 to increase the proportion of the nation's public and private schools that provide access to their physical activity spaces and facilities for all persons outside of the normal school hours, that is, before and after school, on weekends, and during summer and other vacations. I'll be focusing on two main points. First, the significance of after-school programs for children, and two, the physical activity levels of children that are out for after-school programs. And this was measured by adding the number of public schools and private elementary, junior, high school that provided community like programs for after school, and dividing that by the number of total schools. So now looking at the differences between physical activity and exercising, as I have in the top right, this is kind of a typical confusion between physical activity and what exercising is. Some people think they're the same, but physical activity is a movement that is carried out by the musculoskeletal system that requires energy, meaning any movement one does is actually physical activity. As I have in the bottom right a picture of children playing soccer and comparing that against showing the difference between exercise, which is planned, structured, and repetitive and intentional movement intended to improve or maintain physical fitness, as you can see in the bottom left, where this professional Dodger athlete pitcher has probably been playing baseball for years of his life. So moving on to the CDC Health Impact Pyramid, I found this pyramid kind of interesting, looking at the very top, which has the smallest impact on children in public after-school programs, and going all the way down the pyramid to the base, which has the largest impact, which is on the socioeconomic factors, and looking at the top, which is counseling and education. When you take a look at the examples, starting with the socioeconomic, the results are poverty, education, housing, and inequality, which has the biggest factors affecting children in after-school programs. And then when you look at what I find the most interesting is what's having the smallest impact on children is eating healthy and physical activity. And one of the first studies that I found done by Trost, this is a student at our school, OSU, in the epidemiology department, and found that after-school programs seem to be an important contributor to the physical activity of attending children in those programs. But nonetheless, these programs can still benefit and can be better. And not only that, but spend more time devoting to physical activity to benefit these children. Current programs for after school, before school, and summer school, and many other programs, is one that's really well known in the United States is After School Allegiance. It's well known in Oregon. I live right in front of Garfield Elementary, and they also have an after-school program with After School Allegiance, and it's mainly known for its educational benefits. It's not strongly associated with physical activity, which I find a bit strange, but they do give some time for the children to exercise, but it's mainly focused on homework and understanding like what's going on with the children and how their day was, and kind of getting them feeling like a home, building a community with them. The program also gains assistance from other institutions and communities around, making the after-school programs not only fun but exciting for the children. And what I mean by this is that the institutions such as like libraries are giving resources such as books. There's gyms that are offering not just offering, but they're giving these programs like jump ropes and resistance bands and soccer balls, basketballs, so that these children can be more physically active. Something that I found was that 90,000 children in the U.S. are in this after-school allegiance program. 200,000 are just waiting to be in a program, and 100,000 other students across the U.S. are alone and unsupervised, meaning that they go home by themselves, or they are running around with their friends. On a personal level, when I was in middle school, whenever I went home, I didn't have anyone to go home to, so I would stay in the after-school program called Extract. It's well known in California, mostly known in the San Diego County, that provided meals and snacks, had sports that the students could join, and as well as educational assistance, so helping you with your homework and just building a little small community for the students, such as myself. For the founder of the Extract, I became good friends with him back in middle school, and he got his funding from the Boys and Girls Club, which helped fund and allow the children at the middle school that I went to join the sports of the Boys and Girls Club and help them be more physically active. So now looking at the pros, advantages, and benefits, so now looking at the cons, disadvantages, and cost. Some of these programs around the U.S. Cost money. Some parents may be unwilling, or unable to pick up their child at the programs. Most of these programs that, like I mentioned earlier, have already reached capacity where 200,000 students are just waiting to get into a program. Underprivileged cities may not even have any after-school programs for children. This may be due to no motivation or no resources. Institutions may not be willing to offer resources because it just may be of no use or unvaluable. Volunteers and faculty may also be unexperienced in working with certain population students, so students that are coming from households that are troubling to them, students that may be too aggressive or have disabilities, and these volunteers and faculty are just unexperienced and not used to working with these populations. Also, they just may be unable to help the child in general, not knowing exactly how to help the child with their homework and, as I mentioned, home issues. So looking at the progression of physical activity in the past 20 years, almost 30% of the national public and private schools provided access to their physical activity spaces and facilities for all persons outside of normal school hours, meaning that these were just after-school programs that were being offered to students. That is before and after school and on weekends, during the summer and any other vacations back in 2006. A study was done by Healthy People in 2019 looking at the populations in the last 2 decades. And looking at the total at the bottom left, where I have the baseline at 2000 with 35.2% of the population of school were offering after-school programs. 6 years later, it's decreased by 6.4%. 8 years later, in 2014, it decreased another 2.9%. And hoping in the next year, 2020, a desired increase of 5.8%. And in one of the studies I found done by Mary Shawn in 2001, responses from almost 1,600 students revealed that the vast majority did not participate in after-school programs. And that was about 77.2% of them. And 86.5% of the students reported that they spent extensive time watching television or hanging out with their friends. But why? Why does this all matter, and what can we do to help hit the desired population percentage for the year 2020 by gaining that 5.8%? First off, we can try by getting more funding from the school and government, reaching out to the community and institutions by not only getting resources such as books from the libraries, more jump ropes, and more exercise equipment for the children from gyms, and also getting volunteers possibly from not only the community but from colleges for them to gain hands-on experience and be able to give children more creative, untraditional environments that they're typically used to in traditional school settings. And how does this all relate to me? I'm currently studying to be an athletic trainer, and as shown in the bottom right picture, or athletic trainers are known to be on football fields and soccer fields, helping prevent and take care of athletes, but they're also organizing and making professional health decisions for the well-being of the community, and that's what I plan on to do. That wraps up the end of my presentation. Thank you.